I'll do his bio and then we will go into his presentation. But a little bit about our guest speaker. Dr. Ireifej graduated from the State University of New York at Binghamton, where he received his Bachelor of Science degree in biology in 2001. He then attended Cornell University, where he received his Doctor of Veterinary Medicine in 2006. After completing his studies at Cornell, Dr. Ireifej participated in an intense one-year small animal medicine and surgery rotating internship at Angel Animal Medical Center in Boston, Massachusetts, followed by 2 rigorous one-year small animal surgical internships at Long Island Veterinary Specialists in Plainview, New York. Dr. Ireifej achieved his board certification in small animal surgery by completing a 3-year small animal surgery residency at Long Island Veterinary Specialists, and subsequently became a diplomat for the American College of Veterinary Surgeons. After operating for almost 10 years at Long Island Veterinary Specialists, Dr. Ireifej elected for warmer weather, who can blame him, and transplanted to Las Vegas, Nevada in 2016. In Las Vegas, Dr. Ireifej joined the True Care for Pets in the Los Angeles, California area. Oops, I missed a whole sentence here. In Las Vegas, he became a staff surgeon at Las Vegas Veterinary Specialty Center. In 2017, he began flying across the United States, performing surgeries at a number of emergency and specialty hospitals in need of surgical assistance. This was followed by a chief of surgery position at United Veterinary Specialty and Emergency in Silicon Valley, California. Managing their 3 locations, Dr. Ireifej and his team successfully cared for dogs and cats in the Campbell, Mountain View, and San Jose areas. All areas where we get a lot of our students from, so very good neighbors to us. In 2018, Dr. Ireifej joined the True Care for Pets in the Los Angeles, California area as chief of specialty, where he was instrumental in morphing the after-hours and weekend emergency hospital to a successful 24/7 emergency and multi-specialty veterinary hospital. While the size of the hospital tripled, Dr. Ireifej instituted hospital-wide protocols managing the surgery, internal medicine, and oncology departments, and became a leading force on social media platforms. In 2020, Dr. Ireifej changed gears in his already illustrious career, finding a novel and state-of-the-art means of reaching concerned pet owners and their ill parents worldwide, Vet Triage. Dr. Ireifej currently serves as their chief medical director. He has been published in scientific and medical journals and enjoys lecturing to a variety of audiences. He's known for being a positive and energetic force, both professionally and personally. So it is my pleasure to welcome Dr. Shadi Ireifej.
Thank you so much. Thank you for having me. That was very sweet. I don't know if I've had anybody actually read out my entire bio before at one of these, at a lecture in person or on a webinar. So that's pretty cool. Thank you. So this lecture will be fairly generalized. It'll cover a lot of the sort of what you need to know for owning a pet, and then some will be specific to Nevada. I'm an open book. Any questions you have, either regarding this lecture or other topics that are veterinary that are not on this lecture, feel free. I'm happy to answer any and all questions you guys have. So, and as Kimberly said, I've worked at many different facets. I've done everything from being an assistant, a kennel person, to receptionist, to technician. I worked with rescue organizations, done the general practice thing, emergency specialty. So I'm fairly well versed in a variety of different aspects of the profession. So any questions, I'm happy to try and answer. So I figured we start off with, this is an outline of the lecture, so I figured we start off with where you can take your pet. What are like some options depending on the situation and what you're looking for. Then we'll talk about some pet safety, and that's more the medical side of things. This will cover very common topics that you'll find, or common issues that you'll find in Nevada, like, for example, heat stroke. It gets really hot out here, or certain wildlife that you may unfortunately have to run into, toxicities, things like that. What I don't have here, but I'm happy to talk about, is anxiety in pets, especially with COVID, the pandemic, and everybody kind of working from home, and how that may translate to their pets once things begin opening up and folks maybe start going back to the office. So we can talk about that as well, if that helps everybody out. And these are some silly pictures of me at various veterinary conferences. The middle one is a Shar-Pei. I don't know if everyone's seen a Shar-Pei before, but this is one of the most wrinkliest ones I've seen. So in general, this is a definition from the majority of veterinary medical board, their statutes. They'll define a veterinary facility as a veterinary building where, a building where veterinary medicine is practiced, and it could be an actual stationary brick and mortar facility, it could be a mobile veterinary clinic, it could be a kennel, and it's controlled by a veterinarian. So the species that we as veterinarians split into are small and large animal. Large animal are a lot of your production animals, so pigs, cows, and there's the equine side of things with horses. Small animals are, of course, dogs and cats as companion animals, is what we most commonly think of. But then you also have exotics, things like ferrets. You've got fish. You've got a variety of wildlife as well, raccoons, squirrels. So there's a lot of species that are covered in these two very, very broad categories. And in general, when you look at a veterinary staff at any given clinic, you've got a doctor of veterinary medicine, of course. You have a veterinary technician and a veterinary assistant. There's receptionists as well that work the front. There are folks that have to maintain the cleanliness of the building. There's a variety of other factors that also play a role. But in general, medically speaking, you've got a doctor, the technicians, which are our version of nurses, and then the assistants. So these are some pretty cool pictures here. That is actually a fish surgery. That fish is actually intubated, if you can see. And so what you do is you run water with anesthetic through their gills, and that's what keeps them under anesthesia. And I think this doctor removed a tumor either on the skull or actually affecting the brain from this fish. So the entire surgery is performed like this. I think this is from Cornell, but I don't remember. Then you have a picture there. That's me doing a telemedicine consult on some sheep that had a prolapsed uterus. I didn't show the gross part, but it did have a prolapsed uterus there. Hanging out with a horse. And then the boxer here, let me minimize my screen. There we go. Oh, that boxer there. I think in people, this is a recognized condition as well. When you have the trigeminal nerve affected, usually with neuritis, but it could be also a tumor. So if you notice that boxer, it's one side of his skull is dipping inwards. He's lost the temporalis muscle, which that nerve innervates. So it's a sign of nerve damage or disease in that case. So let's start off with a classification of a veterinary hospital, the general practitioner. This is by far the most common. These are the ones you think of that you go to for your vaccines and your spay and neuter. A lot of it's prophylactic care or preventative care, but they also can handle in some degree some emergency cases, and they can even get fairly fancy and even dive into the specialty realm too if they're very experienced general practitioners who also like to purchase expensive toys to do the fancier testing. So in general, the general practice or vaccine clinic, they're usually prophylactic. They are focusing on preventative medicine, which I think we can all agree is really where a lot of our focus should be. We want to prevent disease or trauma from occurring. Of course, we want to treat those things once they happen, but really preventative measures are where really our focus for medicine should lie in general, I think, human and veterinary. So I believe it's the most important part of medicine. You've got vaccination clinic. Again, this is based on the majority of veterinary medical board statutes. That's how they'll define it. They typically are 9 to 5 operations, although that can also vary depending on the clinic. Some are open way more frequently. Some are open like 3 days a week for an afternoon. So it just depends on how they want to operate. For after-hours services, they may or may not be the best if you have an after-hours emergency. And of course, after-hours is kind of defined based on whenever the clinic closes. But typically you think of nights, overnights, weekends, holidays as being after-hours. And so for after-hours emergencies, for specialty care, and for a variety of more unique species, avian, reptiles, amphibians, etc., the general practitioner may not be where you need to go. Some do offer specialty care, so some will have surgeons that are mobile surgeons that'll drive to the clinic to perform your pet's surgery, and then they'll leave after they're done, and your veterinarian, your GP will take care of the pet afterwards. And almost all of them deal with some sort of board-certified radiologist. They'll send their X-ray images or ultrasound images to a radiologist electronically, and then get a write-up from the specialist. So there is some specialty with general practitioners, but in general, you're looking for the preventative medicine, prophylactic procedures, daytime hours of operation with either no specialty or a small amount of specialty, with usually dogs and cats, occasionally dabbling in the exotics, but beyond that, that's where their function typically will be limited to. Oh, and that dog It's a beautiful picture. It's a client of mine from Silicon Valley. If you see the scar over that golden retriever's nose, she kept developing these sores, these oozing sores over the nose, and I was trying to manage it medically because that's kind of a weird thing, and eventually I CT'd it, came back as micro abscesses in the bone, so eventually I just ended up resecting the entire portion of the nasal bone there, and that took care of the problem. So beautiful golden with now a scar, but this is a couple years ago now, so hopefully we've healed up from there. Then you've got your next classification, emergency and specialty hospitals. And these are typically 24/7 operations. Now, they don't have to be. There are some emergency hospitals that only operate overnight, or only operate evening, overnight, weekends, holidays. Basically, whenever the general practitioner is closed, they try to be open. There are a lot of emergency clinics now that are starting to go from just doing after hours to doing 24/7 because the need is so huge nationwide. And you can have either an emergency hospital on its own, or they'll team up with a specialty hospital as well. And so this is the state of the art, the gold standard, the top of the food chain type of clinics. They're dealing with traumatic cases, complicated cases, and they try to really mirror the human side as being like trauma centers and being certified by AHA. There are typically 24/7, although again, like I mentioned, some can be just evenings, overnights, weekends, holidays. They typically, the ones that have specialists anyway, will have on-call specialists, most commonly surgeons, for those types of surgeries. Sometimes they'll have internal medicine doctors on call as well to do emergency scopings. So passing a fiber optic cable down the throat of a dog or a cat, usually to retrieve something that they ate or something like that, for after hours emergencies, those things that can't wait for the next day. The specialty care side of this will be quite variable. The majority of them will have kind of what we consider the core, what I consider the core specialties, which would be internal medicine, dealing with all the internal medicine diseases, and surgeons performing either neuro, orthopedic, and soft tissue surgeries. Some will have criticalists, which are emergency doctors that are board certified in emergency medicine, but the majority of emergency doctors are your normal veterinarian that didn't go through a residency to become specialized, but they are house doctors. They are performing they're seeing emergency cases. And so a criticalist is a board certified emergency doctor. An emergency doctor in general, or a staff doctor or a house doctor, is a regular veterinarian, but they are operating as an emergency doctor. The other specialties that can be involved with specialty hospitals are things like oncologists. We always deal with radiologists, sending out CAT scans, MRIs, X-rays to a board-certified radiologist electronically. Sometimes the radiologist is actually in the building. Most of the time, it's electronic transmission of images. Some have anesthesiologists, cardiologists, ophthalmologists, dermatologists. We've got all the specialties that you would think of for the human side. We are not super specialized, so you're not going to find just like a paw surgeon or a thoracic surgeon for dogs and cats. Usually the surgeon will do everything or almost everything or the majority of things. They'll do it all. So we don't really have specialty. We don't have super specialties or subspecialties rather. And then species, again, mostly dogs and cats. The ones that do large animal typically only do large animal, and they will provide an ambulatory service to actually come to your house or your farm or wherever the pet is located. Otherwise, you'd bring the pet in a trailer to the hospital. And then, of course, you've got some that do avian and reptiles, amphibians, wildlife. Those are hard to find, but they do exist. So this is where you're going to go if your general practitioner either is booked solid and can't fit you in, you have an after hours emergency, a holiday emergency, a weekend emergency, or you have a case that's so complex that your veterinarian is just out of options or doesn't feel comfortable anymore with managing your case, and so then we'll send you to the specialty hospital. This picture here in the center is a dog that I did an amputation on for a malignant melanoma that already had spread up the lymph nodes. And so this is basically just kind of like a hospice care, very cute dog, Buddy. And we removed the limb on that one. And then the one you see there, the dog with the needles in the nose, that's actually a golden from before. And the CT scan, that was me trying to do a targeted CT to figure out how much I need to resect of the nasal bone. Then you've got ambulatory service. This is not that common, but there are companies that are either related to a veterinary hospital or that are their own independent company that provides ambulance service for your pet. When, for example, we had the riots in Chicago this past year, this was very, very useful for folks who had a curfew and they couldn't leave because it was too dangerous. So an ambulatory service for your sick pet was a fantastic maneuver for those folks. That mass truck that you see there was during 9/11. A doctor that I'm actually working with currently to try and provide telemedicine services for in cases of other future disasters, designed this truck on the spot and was able to do surgery, x-rays, blood work, all in that bus for 9/11. And so that was down at Ground Zero. So ambulance provides transport, obviously. It can be used as a mobile clinic or mobile hospital. Hours of operation are going to be variable, just depends on the company and what they're doing. Specialty care, I don't really know. A lot of them they're doing general practice stuff. And then species, again, kind of depends on how they want to operate. Most are dogs and cats. So the picture in the top right corner, the Haven Animal Hospital, is one that I found that's in Las Vegas that offers a pet mobile service. AmbuVet, pet ambulance, see on the bottom there's a very common one. They have cages in there, oxygen supplementation in there as well. So they can do, again, the folks who are driving these vehicles are not necessarily medically trained per se. They're going to do very basic stuff just to get the pet from one location to a hospital. That's the goal with these cases. So for example, they'll either grab your pet from your house and get your pet to the hospital, or if your family veterinarian closes at a certain time and that pet has to be transferred, then they can also call upon an ambulance to transfer that pet to the after hours emergency hospital, for example. And then these are the actual mobile clinics. These are much more popular, you can imagine, since the pandemic. Folks can't leave their homes. They don't really like the curbside thing, and so if they can get a veterinarian to come to their house, their place of residence, then that's another service they provide. So these are typically handling uncomplicated cases. You're doing everything out of your truck, your van, your bus, or in the home, and so you're really going to be limited as far as how fancy you can get with medical care. Hours of operation, usually your typical 9 to 5. I don't know that there are any, well, I just don't know if there are any mobile hospitals that operate after hours, emergency type weekends, holidays. Usually it's the general practitioner time slots. And then, there's multiple obvious client and pet benefits. So for example, white coat syndrome, which you see in people too, and you definitely see in animals, that is defined as physiologic changes that occur in the presence of a doctor or physician because of some kind of stress or anxiety that is fueling that. We see it in all species. And so things like blood pressure, heart rate, respiratory rate will be altered, not because of disease, but because of anxiety or stress, just by being in the presence of a doctor or being in a hospital. And you can imagine if people get white coat syndrome, you can imagine animals that don't understand why they're there, they definitely get anxious and stress fueled. So if you can examine the pet in their natural environment, it may eliminate or at least mitigate some of those physiologic changes that you see with white coat syndrome. Species, a variety, just depends on how the company wants to operate. And then diagnostics, typically they can or try to perform blood work, fecal exams, x-rays, urine testing, things like that. They either can perform it in their vehicle, or once they collect all the samples, at the end of the day they submit it to an outside lab and then get results back and go from there. So this is if you're looking for convenience and you have a pet that won't do great in the car or at a veterinary clinic, then there you go. These maybe can run a little bit more financially because you are paying for the convenience of the vet going to you, but it may be worthwhile to you. And then I added another classification. So all the classifications you saw before are mentioned in almost every state's statutes. Telemedicine, although this is changing, excitingly so, is not mentioned in every state. And if it is, it's mentioned sparingly. And it's not very specific. I think that I'm predicting, and I operate my company, Vet Triage, in this manner, that eventually you'll have another category of veterinary medicine, the televeterinarian. You'll have your general practitioner, your emergency, your specialty, you've got your rescue organizations, and you've got your televeterinarian. It's going to be a total classification. It's inevitable. And so right now there are plenty of states that are changing their laws, and my company's involved with some of those changes to try and basically get up to speed. The human side went through similar turmoil trying to figure out telemedicine. Now, of course, it's a household name, especially since the pandemic. Veterinary telemedicine is now beginning to bloom. So my company, these benefits here on the side are focused on my company because I believe that we are providing the gold standard care. Although biased, perhaps you'd say, I have yet to find another company that rivals us, and I scope out the competition quite frequently. Veterinary telehealth company, it's veterinary owned. I only have doctors on staff. We are 24/7, 365, we're global. We've gotten calls from all over the US, Canada, Haiti, Germany, Lebanon, Australia, Marshall Islands. We provide various functions, rescue organizations. We've helped them save thousands of dollars from avoiding emergency visits that were unnecessary. We provide answering service for those general practitioners that do their own on-call after hours on weekends and holidays. Case allocation for those emergency hospitals that have wait times that are exceeding 10, 12 hours, which is happening nationwide. So we're trying to figure out, well, okay, do you have to be there? Should you wait 8 hours to see the doctor? Or can we through telemedicine, take care of your pet, band-aid things to get you to your veterinarian when they open tomorrow? Direct to consumer, folks that find us organically through Google searches or what have you, or from social media or from word of mouth. And most recently, actually, under that various category, we're working with the military to help with their military working dogs for training purposes, and also if they get injured in the field. If you can imagine, if you're in the middle of nowhere and your canine is injured, those soldiers have some basic medical care. But boy, will they feel a lot better if they can access a veterinarian 24/7 to help direct what they need to do. They can't get to a veterinary hospital in most cases, or the dog is too unstable to go to a veterinary hospital. And so we are currently working with them. That is very, very exciting, and so look forward to that. We take care of all species, and I'll show you some pretty cool pictures as you can see here. And then the veterinary client-patient relationship. This is unique to veterinary medicine. I don't think you have a similar type of relationship with the human side. This is a relationship that's established once the veterinarian meets the pet owner and the pet or pets in person, where they can physically examine the pet. Once you do that, you have set up the VCPR, veterinary client-patient relationship. Obviously, with telemedicine, it is impossible to physically lay hands on the actual pet. And so the VCPR is important because that's one of the main reasons why we're not allowed to prescribe medications. And so when I say we need to get up to speed on the veterinary side to match the human side, this is a huge, huge factor. And most of the lobbying that's occurring right now across the US focuses on the VCPR, opening it up so that telemedicine doctors on the veterinary side can establish a VCPR, can prescribe medications, can provide even a preliminary diagnosis, although you can't confirm with testing or listening to the heart or lungs, but be able to do something more than what we're allowed to now. And so it's very, very cool. Very cool things are happening. These are some examples of triage sessions that I performed in my company. The woman there with the kitten, that kitten was severely anemic, it looked like. She just had fleas on her, and the cat was anorexic, lethargic, gums were very pale, and so my presumptive diagnosis is a flea associated or flea infestation associated anemia from blood loss. The top right is actually one of my classmates from Cornell, Dr. Bruno. She works in Texas. She's fantastic. She's just modeling for me to show dental disease in her dog. And then there's a turtle, a red ear slider that we took care of as well on vet triage. So some other cool species. We have helped 23 different species now. Just this past week, 3 rats. For the first time ever, rats. So that made number 23. There you can see there's an albino rabbit. They were having some kind of skin issue. We presume probably mites or something like that. She had a whole bunch of these rabbits. She breeds them. That pig there had a 106 temperature, rectal temperature. So I sent that one to emergency. Goldfish. We've had a handful of goldfish, a koi fish, a pleco fish on this service as well. Down the bottom there is that same sheep with the uterine prolapse. You see a chicken there that has a discoloration at the bottom of the beak. I think it was probably an abscess there. You can see a reptile, I think. Let me minimize this. Yeah, there we go. You have bearded dragon. And the top one is pretty cool. That's a baby turkey that I think had septic joints. It could barely use its hind legs. And so I asked them to perform physical therapy, and they emailed me this picture. That's why I'm not in there, because it's an email picture. And so she was trying to stretch the joints in combination with treating with antibiotics that were able to get the local pharmacy, because they live in the middle of nowhere. And so that turkey was making a recovery there. So now we'll dive into more of the environmental protection aspect of this. Heat, big one. Especially in Nevada, where it gets 120 degrees plus in the summertime. So we'll go over what I have here, and then we'll talk about some concerns that I have with heat stroke. Booties are used to protect their digits, their digital pads, from burning. Once you have trauma to the pads for whatever reason, it takes a long time, weeks to months, to heal, because the pads are dead skin, right? They're keratinized tissue, and so because they're dead skin, they heal slowly. They will eventually heal, but as you can imagine, you can't have dogs walk on crutches, right? They have to walk on all four legs, so they're putting pressure on what's already injured tissue. So booties are a really good way to prevent burning. Weight loss. It's known that you can exert. You're more likely to dissipate heat from your body if you have less weight to carry around. You're not going to get as overheated easily if you're leaner. So we like weight loss. And of course, for many other reasons, but specifically with heat. You want to minimize exposure. Be conscientious of the fact that your dogs have a lot of hair, especially when I see the winter breeds, Alaskan breeds out here, like the Malamutes and Huskies. That's a lot of hair. Those dogs in general like cooler temperatures. So imagine having that fur coat on you when you're going for a walk in 100-degree weather. So you want to minimize exposure to the heat if you can. Walk in shaded areas, have water available when you go on walks. Focus on that, because that's obviously, if you can minimize exposure, then that will significantly decrease the chance of having heat stroke. Minimize exercise. Dogs love to run. They love to be active. And sometimes they won't even listen to their own bodies telling them you're overheating. So be conscientious of the fact that when you're playing in a dog park outside, your dog doesn't know when to stop. They're having too much fun. It's only until their body can no longer compensate that now you have a life-threatening emergency. And then there's breed factors. So in relation to the weight loss aspect, where it's harder to dissipate heat when you've got more weight on you. Well, some dogs, like the squished faces, the brachycephalics, the pugs, the bulldogs, the beagles, the pit bulls, the spaniels, the squished faces, they already are having difficulty breathing just by virtue of their anatomy. And dogs do sweat with their tongues. So if they can't get rid of that heat because of a predisposition like that, well, then that's going to make those dogs even more susceptible to heat stroke. So more commonly when we see heat stroke in a clinic, it's always this overweight bulldog that got overheated. Now, what is not on here is what to do at home. Obviously, heat stroke is an emergency. If you think your dog is having a heat stroke, don't start treating by cooling them off before you can at least document they actually have a fever. Because the signs of heat stroke are generic. Collapse, panting heavy, breathing heavy, panting hard, whatever. Lots of diseases can cause that. So the most dangerous thing you can do is cool your pet down when they don't actually have a heat problem. So check a temperature, a rectal temperature. Normal dogs and cats should be somewhere between 100 degrees Fahrenheit to about 102.5. Some dogs run a little higher at 103, but that's your range. Document you have it, and then of course seek veterinary attention. And if you can, for whatever reason, then at least you know you have a high fever, you have high body temperature, and you can try to cool them down. But you also can overshoot it. That's why I want this under the direction of a veterinarian, and that's why vet triage is so useful. Because if you can't go to a vet for whatever reason physically, or your dog is so critical, you're afraid that they're going to pass away on the way to the vet because you're losing valuable time, well then vet triage right from any device. You can access a veterinarian and they can direct you on how to take care of these pets. So be very careful when trying to assume your dog has heat stroke. Be very careful in documenting it and be very careful with treating it. It's preferred that it's done under the direction of a veterinarian. Cold. Usually not a problem here, although I imagine if you do some pretty daring hikes with your dog, maybe you'll have frostbite or hypothermia. But you want to make sure your dogs are covered with some clothing. Again, minimize exposure, and breed factors are the same, kind of the opposite, right? The more hairy dogs, St. Bernards, the Malamutes, the Huskies, they're well adapted. If you're looking into the hairless ones or the thinly haired dogs, well, they might be more prone to to cold dangers. So be conscious of that. And these are just some stock photos of there's a dog wearing booties, obviously, and some sort of a covering, and there's another dog there on the right with a really cool coat, looking stylish. We don't see this too often. If you do see frostbite in dogs, it typically is going to be their extremities. You're going to see it, the tip of the ears, the pinna. You'll see the tail, digits. That's where the circulation becomes more fine, and those smaller blood vessels are prone to external trauma, whether it's physical trauma or whether it's temperature related. That's where you see it, the extremities. Water/drowning dangers, they happen. Everybody out here in Las Vegas has pools. It's hot here. And so you need to make sure that you monitor your pet. Not every dog is comfortable swimming. Not every dog should swim. Some dogs should not be left alone by a pool. So it can occur in natural bodies of water, and it can occur in man-made water structures. So there's a dog in the bottom with a water float thing. And so make sure that you monitor your pets. You have to gauge how able they are to swim if they're going to swim. And then if you have a dog that obviously is drowning, you have to go to a vet. There are so many repercussions to drowning that you grab them and you go, or you call that triage. But really, you need to go to a clinic for these. And the same with heat stroke, and maybe a little bit with the cold. But the body is a very complex entity. When you have severe disease or trauma, it affects multiple organs. Heat stroke is great from a medical standpoint because it can affect every single body system. They can get very complex, these cases. So drowning is a similar thing. Wildlife, snake bites. So some clinics out here have anti-venom for these types of bites. The reason why snake bites and scorpion bites are so important is because you're in a desert. That's where a lot of these animals live. And also, these bites, typically, depending on who bit the dog, what species bit the dog, you're looking for two different effects to this, medically speaking. One is local effects, so meaning at the site of the bite. The second is systemic effects. How is it affecting the body distant from the site of the bite? And so if you look at that dog in the bottom right there, that's your typical scenario. Most dogs get bit on the face because they're investigating the snake. They're curious. So that's where they're going to get bit, usually. They can also get bit on the bottoms of their paws, to the bottom of their legs, rather, because they're just not watching where they're walking or whatever. And that there's a local reaction right there. You've got the face swelling up. You can see there's devitalized tissue. Those black areas there is probably dead skin, and that'll eventually slough off. But you've got local reactions there. Then coyotes and so snakes and scorpions. So you may not have seen the bite, and any other thing can cause that type of swelling, right? A bee sting with a bad reaction can do the same thing. So you have to treat it as a worst case scenario, meaning you see something dramatic like that, you go to a vet. You can also call vet triage. A lot of times these things are happening while you're hiking, while you're on vacation. So it may be an area that you're unfamiliar with, you don't have great reception, or you're too far away from your car, and so you can use a telemedicine company to access veterinary advice. Coyotes and wolves are sad cases because it's always the smaller dogs that get attacked. They just went through a doggy door, they're peeing and pooping. Next thing you know, a coyote's been waiting, and these wild canines, they're going to win the battle. And sometimes they're in packs. So these are sad cases. We've seen some really horrible traumas with these. But it's like any other trauma. You have to rescue the pet and go to an emergency hospital. I'm not familiar with any sort of deterrent. I know people talk about coyote urine or something you can buy online. I'm not sure the efficacy of these things. It's really a matter of walling off where your dog has access to and making sure that they're supervised, especially during the nighttime, especially if they're smaller pets, especially if they're pets that have like dementia or blindness or something like that. You really want to watch them. Toxicities are very common. Marijuana, of course, is becoming more and more legalized. We see this all the time. Thankfully, it takes a large amount, an experimental amount of marijuana to cause really bad to be life threatening to your dog. But marijuana toxicosis, sometimes what they actually ate that included marijuana is more dangerous than the marijuana itself. So, for example, chocolate products, foreign bodies, all the time. And that's a video of my YouTube channel performing a gastrotomy. I'm just removing a ton of just like yarn from this dog's stomach. We see foreign bodies all the time. You name it, we've seen it. So foreign bodies, when they ingest the foreign body, the foreign object, it usually causes an obstruction somewhere in their gastrointestinal tract, and that's a medical emergency. Rat poison, very common. Toxicity as well, especially if you know you have it. Sometimes the dog or the cat eats the rat that ate the poison, and then you have toxicosis that way. A variety of human medications can cause issues. Obviously, you need to either call a telemedicine company, go to an emergency hospital, or call the ASPCA poison control. Just Google them, have that number ready, or have that triage ready, whatever, so you can intervene quickly. Chocolate toxicity is super common. Xylitol is that sugar replacement sweetener that you see in gum, very toxic to dogs. Oleander is a poisonous plant. It's very common in tropical or hot regions of the states. So oleander is very common here. You see it everywhere. And sago palm is another plant that you see also in Nevada too, that can cause a pretty bad toxicosis. So that the top two pictures are oleander. The two bottom ones are that sago plant. And then finally, trauma. These are fairly self-explanatory. Getting hit by a car, keep your dogs on a leash, hiking accidents, jumping out of an apartment building, impalements. These are all things that can happen. And so this is the dog that I operate on. That's the pelvis up there. And so we did pelvic surgery on that dog to stabilize him. That's a cat with a jaw fracture. So that's some implants there. That's me actually performing a vet triage session while I was hiking. And so it's the importance of being portable. You want to make sure you're always accessible to folks. And then finally, to finish off, we're involved with lobbying, as we said. Every doctor, I would believe human and veterinary physicians, don't like Dr. Google. We don't want people Googling symptoms and self-diagnosing, self-treating. That's why telemedicine exists now and it's so useful. We're trying to improve the veterinary culture with vet triage, minimizing these wait times, allowing veterinarians to have a job where they can work from home, especially if they can't handle the clinic setting anymore. We can talk about separation anxiety if you guys still have time. I'm happy to dive into that. And those are my contact information there if you want to message me on YouTube, on Instagram, and of course Vet Triage is my company. We're working with the VVCA to try and help change the laws, and we're hoping the AVMA, who's our really one of the largest group that kind of manages veterinary ethics. We're hoping that we can interact with them as well to sort of get things moving in that direction. Thank you very much.
Thank you so much. I did not know that about oleander or sago palm, so I appreciate that very much.
Oleander is so intense. Even if you were to, as a human being, if you took an oleander branch and roasted marshmallows and then ate the marshmallow, now you're affected. Every part of that plant, which is unique to that plant. Most plants, it's a portion of them. The oleander, it's incredibly cardiotoxic. It affects the heart.
Oh.
Yeah.